We'll start about the health. Okay, so before going to what is the care that has to be taken in the monsoon, just a minute, close.
Yeah. Come in here. I will keep it here. Once completed, count. I will let you look at.
Okay. Yes. So let us go ahead with what are the diseases that is seen during the monsoon. So before going to what are the care that has to be taken during the monsoon changes. So all of us know that monsoon changes. Monsoon means rain. So can anyone tell what are the diseases that you can expect in the monsoon season? Hello. Hello. Yes.
Oh, okay.
Can anyone?
Yes, Soumya.
Yes. Can anyone guess what are the changes, or can anyone? What are the diseases that you can expect during monsoon season?
So malarias
Yes.
and dengue fever.
Yes.
Yes, this type of diseases.
Yes. True. Actually, because of water, basically more of water stagnation, we can see different. There we can see vector-borne diseases, basically mosquito-borne diseases, and water-transmitted diseases. So how does this change? I mean, why does these occur? First is change in temperature and humidity. Because there is a change in temperature and because there is some moisture in the atmosphere, these two temperature and humidity makes it more makes the bacteria or the organism more favorable for growth and survival. So once these things start growing, there is more contamination either by food or by water. As a result, there is a transmission of germs through food, water, and sometimes yes, vector like mosquitoes, houseflies. So when we categorize the diseases during monsoon season, it can be categorized as mosquito-borne diseases, as you all said right now: dengue, chikungunya, malaria. These are all mosquito-borne diseases. Then water-borne diseases, that is diseases transmitted through contaminated water. These basically typhoid and cholera are the two major diseases which is waterborne. Along with it, sometimes diarrhea and leptospirosis also we see. Airborne infections like common cold, flu, and lastly but not the least, most of us do find fungal infections of skin very common during this monsoon seasons. So coming to these infections one by one. First, dengue. So all of us, I think, are familiar with dengue fever right now, right? Yes. So this dengue is transmitted by a mosquito called Aedes aegypti mosquito. This is also known as tiger mosquito because of these white strips. So it is transmitted by this particular mosquito, which usually bites during the daytime. So daytime biting mosquitoes are more dangerous when it comes to dengue fever than the night biting mosquitoes. And these usually survive in clean water more. So, water stored at home or, rainwater collected in rainwater collected in the utensils or any which is not closed. These kind of, these kind of environment are very helps in these mosquitoes to grow. So once this is transmitted by Aedes aegypti mosquito. So what is the symptom of dengue? When do you think it is dengue fever or when do you suspect dengue fever? Basically, yes, one is the monsoon season, especially this season with high grade fever, body ache. There will be fever which is high grade, body ache, headache and joint pains. So these are the initial symptoms. If what happens during this initial phases, just a fever, body ache, headache can be dengue fever. Then slowly once the platelet counts comes down, skin rashes do appear. Sometimes a petechial skin rashes do appear. So it can be different types of dengue fever. Mild, moderate, and severe. In mild dengue fever, we can treat the patient at home basically with paracetamol and hydration. See, hydration becomes very important in such kind of viral fevers. But if sometimes patient can go into severe dengue shock-like syndrome, at that point of time, hospitalization is important. Hospitalization is also important for monitoring platelet counts if platelet counts go less than 50,000. So at that point of time, the treatment includes, administration of platelet count, and also monitoring whether the patient is going into shock. Hypotension, BP monitoring becomes very important. Sometimes when dengue becomes very severe, there will be fluid accumulation in the lungs, stomach. All these are severe forms of dengue. But at initial or mild fever, mild infection, fever, body ache, joint pains are the commonest symptoms. So severe hydration and monitoring of platelet counts are most important treatment or aspect of dengue fever. Next comes malaria, which is also a vector-borne infection. So malaria is transmitted by another mosquito called female Anopheles mosquito. These mosquitoes survive basically in dirty water. And again, it is as we all know, it is a disease of monsoon seasons. Basically, it is common in tropics and subtropics area where the rain is very heavy rains are there. So what happens during malaria? There is again bout of fever, but this time fever is followed with chills and rigors. So people who are infected with malaria do suffer with severe chills and rigors. So, and fevers depends upon the frequency. Frequency depends upon the strain causing it. There are different forms of Plasmodium vivax, Plasmodium falciform. So there are different forms of bacteria which causes malaria. So each Plasmodium vivax causes fever alternate days. Plasmodium falciform causes fever once in 2 days. So based on the strain, the bouts of the frequency of fever differs, but usually patients will have fever with chills and rigors. So how do we diagnose it? By doing rapid tests and blood smear. There are two kinds of tests. One is called malaria rapid test, which is done quicker, and blood smears where we see the Plasmodium vivax and malarial falciform and malarial bacteria in the microscope. So once it is diagnosed, treatment is easy. We have lots and lots of options of anti-malarial drugs like chloroquine, everything. A lot of anti-malaria drugs are present, but diagnosis becomes very important, since if we don't diagnose it early, we might, patient might develop complications like cerebral malaria, which goes to the brain and things like that. So that's about malaria. Dengue and malaria basically caused by mosquitoes. One is Aedes aegypti and one more is female Anopheles mosquito. Now coming to another vector-borne disease called chikungunya, which is also transmitted by Aedes mosquito. So chikungunya has high grade, again patients presents with high grade fever with joint pains and swellings. So these patients do not have severe, they do not develop into any severe, life-threatening diseases. But what do they have is joint pains and swellings, which is very common. Sometimes it lasts for 2 to 3 months. So how can we test it? Again, we can confirm the chikungunya by doing antigen test or antibody test. And treatment is very simple, symptomatic, giving just full of hydration, good amount of water, and paracetamol for fever. For joint pains and swelling, we can give anti-inflammatory drugs. So basically, chikungunya causes joint pains and swelling. So the three, basically any viral fever, what you have to understand is hydration becomes very important. Be it a dengue, be it a chikungunya fever, be it COVID infection, any kind of viral infections, hydration becomes very important. Take a lot of water, drink plenty of water, and rest. Okay. Next, These were the vector-borne infections. Now coming to infections that can be transmitted through contaminated water. Basically, infections that are transmitted to contaminated water, the top comes the cholera, which is less common nowadays because of our better sanitization. Initially, previously, when our sanitization was poor, people used to urinate or post potty near the rivers, and they used to contaminate rivers, lakes, from which we used to take drinking water. But now, since of better sanitization, cholera has reduced. Also because of vaccines, we have cholera vaccines also. This is caused by Vibrio cholerae. This and is transmitted by, as I told you, contaminated food and water. So in cholera, what happens? Patient will have severe watery diarrhea. We call it as rice watery diarrhea. That is, loose stools are so much that it is completely water. So dehydration becomes a so patient goes into dehydration very quicker. So basically, again, rehydration becomes an important part in the treatment. So once patient develops diarrhea, any kind of diarrhea, be it a cholera or any kind of diarrhea, what we have to think about is hydration. So drink plenty of water, buy ORS, drink ORS, oral rehydration solutions, and homemade ORS like ganji, juices, all these will help in regaining hydration and patient not becoming severely ill. Again, antibiotics, doxycycline antibiotics is given in cholera, which will help in reducing the infection. Next waterborne infection, which is very common, is typhoid. Typhoid is still a common waterborne infection caused by Salmonella typhi. So again, it is transmitted by contaminated water and food. So all these are transmitted by food and water. So basically, what we have to think is we have to drink and drink boiled water and eat warm food so that we can avoid such infections. Typhoid, any kind of high grade fever persisting for more than 2 weeks, then we have to suspect typhoid. Any high grade fever or without any diagnosis, then still suspect typhoid. It is so common. Along with, sometimes patient might develop abdominal pain. Sometimes abdominal pain is very common, sometimes no. It is only the fever and tiredness which is very common. Sometimes patient can also develop change bowel habits. That means they might have loose stools or they might have constipation. But what is the main symptom is high grade fever, more than 100 degree, along which is persistent for more than 2 weeks, along with tiredness and weakness. It is confirmed by blood test. Two kinds of blood tests are done. Rapid test again, which is done just like malaria, and one more is called the Vidal test. These two tests confirms the typhoid fever. It is treated. Treatment is very easy with antibiotics. Again, confirmation and suspicion becomes very important. So we treat with antibiotics. Now, vaccination is available. Vaccination had to be taken once in 3 years, but now newer vaccines are available, which if taken once, then it can give protection against typhoid throughout your life. So wherever there is vaccines available, please go and take the vaccine. Okay. Next comes leptospirosis. Leptospirosis, see, this is a rare disease, actually transmitted by contamination of water. So what happens is, this is caused by spirochetes. Spirochetes is a bacteria causing leptospirosis. Usually the contamination this is a disease which is transmitted by animals, basically. So any animals which is which is infected with these spirochetes, when they urinate or when they empty their bowel near the lakes, near ponds, rivers, they infect the water, which is taken, which when consumed by humans, it will cause human infection. So basically, rat, mice, moles, all these kind of, all these animals, even dogs, or the primary host. Human is always a secondary host because of the contamination of, again, water. So what is the symptoms of leptospirosis? Again, high fever, headache, chills. The basic main differentiating symptom is jaundice and vomiting and jaundice abdominal pain. So any jaundice other than where it is not hepatitis A, B or C is ruled out, we have to do a spiral blood test and see whether the patient is infected with leptospirosis. Though it is not very common, we do see some of the patients who infected with leptospirosis presenting with jaundice and abdominal pain. Okay. So again, it is diagnosed by blood test. So early diagnosis and treatment is very important. Treated with antibiotics again. So every one good thing is all our monsoon infections do have treatment and the treatment works good. But only thing is we have to do a early diagnosis. That is very important. Now coming to hepatitis A, this hepatitis A infection also is caused by contamination of food and water, basically food. So it is transmitted through food and water. Again, it is hepatitis. The word hepatitis only tells that it will affect the liver. So the patient presents with jaundice, loss of appetite and vomiting. So usually very common after a travel where they eat a lot of unhygienic food and things like that. So it is again diagnosed by blood test. Treatment, nothing much. Very simple symptomatic treatment with good food and good hydration. It will, it will reduce or it will go by itself. Most of the time, it will subside by itself. And also vaccines are available. Hepatitis A vaccines are given in 2 doses. Vaccines are available for prevention of hepatitis A infection. So anyone who are frequent travelers can definitely take hepatitis A vaccine to reduce such kind of infection. So we finished our vector-borne infections, water-borne infections, and some infections which basically affects our liver. Now, the last infection which is common with monsoon seasons are fungal infections of the skin. So yes, fungal infections these are caused by a fungal called dermatophytes, which basically commonly caused by ringworm infections. Okay, so why is this fungal infection common during in this monsoon? Because of humid conditions. Any humid conditions is a place for fungal infection to grow. So what happens is, along with that, what happens is people start using different kinds of cream mixed with steroid combination and other agents, which will further increase this kind of infection and make it more stubborn to go. So basically, the symptoms will be some, a rash in the body folds like groin, underarms. Sometimes it is itchy, sometimes it might not be itchy also. So you please, once you find any discoloration or any blackish coloration, any blackish discoloration with the center clearing, any of these kind of skin lesions, don't do your own treatment with some medications or steroid creams. Do go to a dermatologist. So treatment again is very simple. Again, topical antifungals creams are good enough for most of the fungal infections. But if it is too very much spread, then we do give oral antifungal medications also. So this is about the fungal infections. So these are the monsoon health disease, health problems that we usually find. So it will be either vector-borne infections like dengue, malaria, chikungunya, or water and food contamination like typhoid, cholera, leptospirosis, hepatitis A, or any of these fungal infection because of the humid conditions. So I think you guys only can tell me what are the preventions we can take to avoid these kind of monsoon related health issues. Can anyone tell? Hello? Okay, so we should keep home and surroundings free of mosquito and breeding places. So we should keep our homes as clean as possible. Basically, keep the home free from collected waters so that there is no mosquito breeding places. Don't collect water and keep. Then, make good arrangements for rainwater to drain off. Use mosquito nets and repellents, very important. Mosquito nets and repellents will help in, reducing these dengue and malarial infections. Avoid visiting crowding places. This is because of this common cold and flu, which is also common. I have not told about common cold and flu because it is a very common infection which can be found very common, and everybody knows about common cold and flu as of now. So again, that can be prevented by avoiding crowded places. Drink clean water. Filtered or boiled water is better. Don't drink water directly from the tap. Eat fresh, properly home cooked food. Very important. Fresh, properly home cooked food. If you are ordering from the restaurants, also better to eat warm food than food which is not boiled. Washing hands before eating after toilet becomes very important, because Salmonella typhi also is present in our excreta, which can again get before and even before cooking. Otherwise, which can we can infect other persons also. And get vaccinated. Get vaccinated for hepatitis A, cholera, typhoid. All these have vaccines, so better to get vaccinated so that our infections are not severe. Thank you. Hello, are you able to hear me?
Yes.
Yes.
Yes, Soumya.
Yes. So this is about the monsoon health issues. So any questions? Anybody wants to know anything in particular?
Team, anyone have any queries on this session?
So it is basically mosquito-borne water or food contamination that can cause issues. So if you can keep mosquitoes away from your home, and if you can eat warm and cook food and water, that should solve all your problems.
Hello.
Yes.
Yeah, ma'am. Sometime what happens when we change our place from cold cold place to hot place?
Hmm.
So when we move, then also we get a fever, cold and flu.
Yes,
So
common cold and flu is where common cold is where you can get even in monsoon seasons, or even even in summer, because those are airborne diseases. But monsoon season is more common because there is more of humidity in the atmosphere. Okay. And sometimes it might be because of allergy. See, all common cold, all cannot be just a flu. Sometimes even cold can be just allergic rhinitis, which are more common in warm places where dust is more.
oh, so common cold is due to
Com-
yeah.
yeah, tell me.
So the common cold is due to
Yes,
any virus or
it can be because of virus. It
yeah.
can be because of just an allergic. See, cold. Cold is something a vague term. So it can be flu, means it's always viral. Viral infections are called as flu. It can be H1N1, it can be COVID, or it can be any other viral infection which is causing some cold. It is called, so flu is always viral. That means viral infection. Sometimes common cold can be caused by viral infection. It can be caused by some allergic issues like allergic rhinitis, or it can be because of bacterial infections also. So cold can be because of any of these. When it is because of viral infection, it is called as flu. Okay.
Okay,
So
okay.
yeah. Any other questions? So I think this monsoon, not many dengue infections or malarial infections anybody is facing actually. Huh? Hello. Hello.
Yes, Soumya.
Yes, I think everybody is clear about things, huh?
Yes.
Okay, anything else? Or shall we end it here?
Yeah, team, any questions from anyone? I think no, Soumya.
Okay. Okay, then thank you. Thank you for giving me the opportunity to talk about these monsoon, related health problems. I think most of you are aware of all these problems, but again, it is just a brush up of what has to be done during the season. Okay?
Yeah, thank you.
Yeah. Okay, bye bye.
Nice. Bye bye.
Have a
Thank
nice weekend. Yeah, bye.
Yes, thank you. Thank you.
Yeah, okay.